Thank you, Greg. I would like to reflect on the technical series for addressing acute malnutrition in Africa's drylands, hosted by Tufts and FAO. The series introduced the research and experience of 21 people living and working in Africa's drylands. The participation of hundreds of stakeholders from nearly 80 countries contributed to shared perspectives and consensus building, marking the beginning of a more multi-stakeholder and multi-systemic approach to addressing this wicked problem. The key lesson was the importance of understanding and addressing the basic drivers of acute malnutrition. Livelihoods in Africa's drylands have evolved to be well adapted to highly variable environments, characterized by extreme rainfall variability, seasonality, and ecological diversity. Local systems and institutions mediate these relationships by supporting livelihoods, strengthening food security, contributing to healthy diets, and ensuring public health and healthcare services. Of particular importance is valuing the voices of dryland residents and the social norms, rules, and caregiving behaviors that nurture inherently holistic approaches to managing variability in dryland livelihood systems. By adopting the revised conceptual framework for addressing acute malnutrition, we reframe the focus from the more immediate and proximal causes back to the basic systemic drivers. In the final webinar, regional and UN organizations presented their perspectives on the Global Action Plan on Child Wasting and how an analysis of these drivers should shape response. The technical series raised awareness about the persistence of acute malnutrition in Africa's drylands and the role of the adapted conceptual framework as part of a strategic multi-systemic approach for its sustainable prevention. We need to move away from our siloed sectoral approaches. Successfully addressing acute malnutrition in Africa's drylands will require going back to the basics on how livelihood systems work, taking holistic community-led approaches, and working to create institutional environments that support resilience. Back to you, Greg.